Stem cells are a type of cell that have the ability to develop into many different types of cells in the body. They are important for the repair and regeneration of tissues and have the potential to be used in a variety of medical treatments. Severe back pain, burns, or the most precious scars can heal with stem cells. Watch this video and discover the world behind stem cell therapy and what to expect for the future of therapy. There are two main types of stem cells: embryonic stem cells and adult stem cells. Embryonic stem cells are obtained from embryos that are a few days old and have the ability to develop into any type of cell in the body. Adult stem cells, on the other hand, are found in various tissues throughout the body and have a more limited ability to differentiate into different types of cells. Stem cells have been used in a variety of medical treatments, including the treatment of cancer, blood disorders, and degenerative diseases such as Alzheimer's and Parkinson's. They are also being researched for their potential use in regenerative medicine, which aims to repair or replace damaged tissue and organs. However, the use of stem cells in medical treatments is still a relatively new field, and more research is needed to fully understand their potential and to develop safe and effective treatments. Stem cell therapy is a promising field for the treatment of burns, as stem cells have the ability to differentiate into various types of cells, including skin cells. However, the use of stem cells for burn treatment is still in the research phase and has not yet been widely adopted in clinical practice. The future of this technique is great, but knowing that it can cure so much and it is still relatively new, we can have a high expectation of this kind of therapy. Do you think that stem cell therapy has a future if this technique is further developed? Press the like button if you think stem cell technology will play a big role in the future, and let us know what you think in the comments. This treatment is going to mean a drastic change in our medical future, and with mass production of stem cells in a kind of super lab, the medical world can change forever. Later in this video, I also discuss the production of these cells, so be sure to keep watching. There have been some clinical trials and studies that have used stem cells to treat burn victims. These studies have generally been small and have had mixed results, with some showing promising results and others showing little to no benefit. It's important to note that stem cell therapy for burn treatment is still considered experimental and is not widely available. I am a big proponent of this technique. There are examples of severe burns that heal within a few weeks, or a worn back that after years of pain is finally pain-free again through stem cell therapy. Stem cell therapy is possible in North America. There are many research institutions and clinics in the United States and Canada that are working on developing and testing stem cell therapies. However, it's important to note that the use of stem cells for therapy is still considered experimental and is not widely available. Also, the regulation and availability of stem cell treatments in North America varies, depending on the country and state/province. The FDA in the US has approved some therapies that use stem cells, but others are still under clinical trials. In Canada, the regulatory body is Health Canada, and the availability of stem cell therapies is more limited. The availability of stem cell therapy varies depending on the country and region. In some countries, stem cell therapy is widely available and regulated, while in others, it is only available in a research setting or not at all. In some countries in Europe, Asia, and Latin America, stem cell therapy is more widely available, but the regulation and oversight of these treatments may be less stringent than in the US. It is important to research the availability and regulation of stem cell therapy in a specific country before considering it as a treatment option. Mexico, Austria, Turkey, Germany, Ukraine, India, Philippines, Dominican Republic, and China are the best countries to get stem cell therapy, where top clinics providing affordable regenerative medicine to their patients. The cost can also be overseen, which fluctuate between $4,500 and $20,000. This depends on each procedure and what kind of therapy you need. The future of stem cell therapy looks promising, as researchers continue to make advancements in understanding how stem cells work and how they can be used to treat various diseases and injuries. There is ongoing research in a wide range of diseases and conditions, such as cancer, heart disease, diabetes, neurological disorders, and injuries. Many clinical trials are currently underway to test the safety and effectiveness of stem cell therapies for various conditions. Additionally, scientists are exploring new methods for obtaining and manipulating stem cells, such as induced pluripotent stem cells, iPSCs, which are adult cells that have been genetically reprogrammed to act like embryonic stem cells. It's important to note that while the potential benefits of stem cell therapy are significant, more research is needed to fully understand the safety and effectiveness of stem cell therapy and to develop methods for scaling up the treatment for widespread use. Overall, stem cell therapy has the potential to significantly improve the treatment of many diseases and injuries and to change the way medicine is practiced. Some researchers have studied the use of stem cells to treat autism, such as by administering stem cells to the brain or spinal cord, or by using stem cells to generate nerve cells that can be used to treat nerve damage. It's important to note that unproven treatments for autism may be harmful, and it is important to consult with a qualified healthcare professional before considering any treatment for autism. Additionally, it is important to be aware of any potential risks associated with stem cell therapy and to ensure that the treatment is being provided by reputable and qualified medical professionals in a controlled environment. Some researchers are also studying the use of stem cells to treat cancer by using them to target and kill cancer cells, or by using them to repair damaged tissue caused by cancer treatments such as radiation and chemotherapy. Hematopoietic stem cell transplantation, HSCT, is already used as a treatment for some blood cancers, such as leukemia and lymphoma. This treatment involves replacing diseased blood cells with healthy stem cells. Additionally, a few clinical trials are ongoing to evaluate the use of stem cells in solid tumors, such as lung cancer, breast cancer, and colorectal cancer. The results look good and the expectations are high. Unfortunately, the regularization of this is very difficult because there are still many studies to be done after this therapy. There are several ways that stem cells can be obtained. Embryonic stem cells. These are obtained from embryos that are left over from in vitro fertilization, IVF procedures. Adult stem cells. These can be obtained from various tissues in the body, such as bone marrow, fat, blood, and skin. The most common method for obtaining adult stem cells is through a procedure called a bone marrow aspiration, where a needle is inserted into the hip bone to remove bone marrow. Induced pluripotent stem cells, iPSCs. These are adult cells, such as skin cells, that have been genetically reprogrammed to act like embryonic stem cells. Cord blood stem cells. These are obtained from the blood of the umbilical cord and placenta after birth. Once the stem cells are obtained, they are usually grown and multiplied in a lab before they are used for therapy. If the technique is developed far enough and you can use it, you can have your own cells grown. If you get sick or injured, those cells can heal you. Your life expectancy will also be higher, so you will have more time to spend with your loved ones and enjoy life as you know it. It's like having spare parts in stock, and you can use them when you need them. And because these stem cells make you better, you can still make optimal use of your mind and body in old age. This is, of course, also very important, because if you are 120 and you can no longer do anything, it is not worth it. The mass production of stem cells is a complex process, but it is possible. Researchers have developed techniques for growing and multiplying stem cells in the lab, which allows for the production of large numbers of stem cells. One method for mass-producing stem cells is through the use of stem cell lines. These are stem cells that have been grown and maintained in the lab for an extended period of time and can be used to generate large numbers of identical cells. Another method for mass-producing stem cells is through the use of cell culture techniques, which allow researchers to grow large numbers of cells in a controlled environment. Researchers can also use genetic engineering and other techniques to manipulate stem cells, making it possible to generate large numbers of specific types of cells. This technique, in my view, is the future of humanity and will change everything. Thanks for watching. You have experience with stem cell therapy. Let me know in the comments. Don't forget to subscribe so that you are aware of the recent developments in this technique.